We didn't go over.
Good evening. Good evening, everyone. And if it's not evening when you're looking at this, may I say good day to you? Thank you so much for joining Sandra and Carolyn in the first of the Women's History Month series. Today's we will be coming to you. We'll be talking about women and stroke. They're according to what I was reading as I was reading articles on what are the 10 health concerns that women should be aware of. What I was coming across was that women should be aware of. One of the things they should be aware of is strokes. So, what I asked Carolyn to do is to come again tonight because she was here last when I did my last video, or when Chams did our last video, she was here talking about obesity and diabetes. And so I was like, you know what? It's Women's History Month. We women are always doing so much more than what we should be doing, or, we just go on 110% for everybody, including ourselves. So let me do some research to find out what we can continue to do or do a little bit better so that we can continue to be here, continue to make those strides, and continuing to be able to tell our stories our way. So Carolyn graciously accepted again tonight to come to us and talk to us about stroke in women. So I'm going to turn this over, and as I always say in my videos, you know, it, we all need to learn. And so I'm going to be quiet, and I'm going to let Carolyn go ahead and take over the talking tonight to tell us all about women and stroke. What is it? What are the signs? Some of the tips that we need to be looking for so that once again, we as women can continue to tell our own stories. So thank you so much, Carolyn, for joining us tonight. And please go ahead with your and let us know what we need to know about women and stroke.
Hello, everyone. I'm like Sandra. I'll just say hello. Um, we're both on Central Standard Time. So I am so happy to be with you again this evening. Thank you for tuning in. Thanks, Sandra, for inviting me back. Um, when she wanted to talk on women and stroke, because it is Women's Health Month. I was like, sure, let's do it. Just let me do a little research and we'll get it done. So we'll talk about women's symptoms first that may go unnoticed, and I found it to be an eye opener. Something as small as hiccups. Women, however, may also have additional symptoms. Hiccups being one of those that may mean that it's a signal that you're having a stroke, nausea, chest pain, fatigue. We're all tired. We all get tired. Shortness of breath, and a racing. So, those are some things that women need to look out for. Studies have shown over the years, um, even when it comes to having a heart attack, women and men's symptoms can differ. So, this is not, it's new information for me. But I'm saying when they were testing and doing the studies of men, they did not include women in the studies. So I think that's one reason that our symptoms are coming up and being explained a little bit more. Now we know that a stroke can happen in anyone. We know that when we have a stroke, the first things we look for: aphasia, speech difficulty, um, weakness, facial drooping, or weakness on one side. We also know that our gait may be off. And we know the number one thing we need to do if we think someone is having a stroke is to call 911, because time is very, very important. We don't need to wait to the next day. We don't need to wait for an hour, because they want, from the time the symptoms start to the time of treatment, we're in a window, and we don't want that window to close. Okay, whether you're having an ischemic stroke or bleed, they won't know until they do a CT scan. And that CT scan will show that if it's a ischemic stroke, meaning it's a clot there that has cut off your circulation. If it's a bleed or hemorrhagic stroke, they'll know how to treat you as well. With the ischemic stroke and the blood clot, they will give you some medication to dilute that blood clot, just so that you can get some blood flow to that area and potentially lessen any damage that may come from that. I did a research on Northwestern medicine, so that's what I'm referencing at this point in time. But we know it's usually a 3 hour window. Some people don't report their symptoms until the following day. Well, you are definitely out of that 3 hour window. Okay. Um, as I say, time is of the essence. If you notice this, fast, facial drooping, aphasia, word salad, people are saying things, but it just doesn't make sense. They're not able to get their words out. Um, Facial drooping, and time. Time is of the essence. So we want to call 911 and not try to drive them to the emergency room. That is not what you want to do, because the ambulance personnel can get through traffic, whereas you cannot. Okay, Sandra, do you have a question for me?
And I do have a question. Are there certain things that bring on strokes, or I mean, it's like is there are there certain, but certain cultures, certain things that bring on strokes for women, especially for women?
It's what you mentioned earlier. A lot of times women are always on that track of taking care of everyone other than themselves. So a lot of times we put ourselves on the back burner, and we may ignore some hiccups. We may ignore some nausea. Maybe I didn't eat well, or maybe I ate something, that wasn't quite, that didn't agree with me. Chest pain, sometimes you have it from indigestion, sometimes you don't. So those things get put further back on the back burner, and we're not really paying attention to it. The obvious signs and symptoms, when a person tries to smile and their smile is crooked, when you get them to raise their arms and one arm drifts, they have just total weakness on one side. Those are obvious signs and symptoms of a stroke. Um, like I said, we call it word salad sometimes. So those are obvious, and you need to move on those. With these others that they have basically during the studies, they have come up with these additional signs and symptoms that women exhibit that men don't, that sometimes get ignored. So now that we're bringing it to the forefront, pay attention to yourself. Put yourself on the front burner. Make sure that you're healthy. Make sure that things are all right. Don't be embarrassed when your tests come out negative. It's best to be safe than sorry, because even if you're not having a larger stroke, you can have that TIA, or that transient ischemia attack, where you have all these symptoms, but they self resolve by the time you get to the emergency room, or they resolve after you get to the emergency room. But when you have a TIA, it could potentially lead to having a full blown stroke, especially if you have a couple of them. Basically, it's like the calm before the storm. So you want to be really cognizant of those signs and symptoms. So, I've had that one time and it just went away. Well, maybe so, but you still need to follow up with your physician, because you might need to be on some blood thinning medication, some anticoagulants, to help prevent any injury. And that fast heart rate, atrial fib, can help form a clot, and that you don't need as well. So we do need to watch us. We need to watch ourselves so that we can make a better determination of what we're doing.
And you know what? It's really things that we have to do, right? We as women, we've always made history. We've made strides. We've done so many things. We continue to do those so many things. And as I often say, we need the men and the men need us. We need to, be more cognizant of protecting our own health so that we can continue to tell that history, to our kids, our grandkids, heck, even to ourselves, and make ourselves so much more better than where we are or where we think we are right now, right? Our history is important. All women, doesn't make a difference what color you are, where you live at, women are women. And we have a sisterhood. So, and that sisterhood is dependent upon us doing so much better with things that we didn't know before. But hey, now that CHLMS is here and we're all about patient education, patient empowerment, and patient engagement, more women can become just that more educated on their own health needs and, stop putting ourselves second and third and make ourselves first, because we can't pour into everybody that we pour into if we're not pouring into ourselves first. We have to. It's imperative that in order for women's history to continue to live, we have to do so much better when it comes down to, making sure that we're taken care of. So, and are there certain foods that perhaps could bring on a stroke, or
Well,
is it not food related? Go ahead.
well, you want to decrease your salt because 9 times out of 10, you may have a blood pressure problem that you're unaware of, or you're not compliant with your blood pressure medications. We want to take some salt off the table. We want to eat healthier. And it was best in some of my research, eat more vegetables than fruits and or vegetables. Sure, we need both, for the fiber content, but fresh fruits, fresh vegetables. Because like we talked about diabetes, um, the fruit has its own sugar in it. So it's fructose. So that can help elevate your blood glucose. So we want to be mindful of a lot of things. But here are some more things I want to put out. Risk factors that are relevant to women when it comes to stroke, pregnancy. Now we know women get pregnant, okay? Preeclampsia. Research shows that having a history of preeclampsia, um, and it's a condition where pregnant women have high blood pressure, can lead to a stroke. Birth control pill. We know women take birth control pills. Um, Migraines with an aura is linked to ischemic stroke. And atrial fib, I mentioned that briefly earlier, can also cause a stroke. And they're saying more women have stroke than men. I didn't really put that together, but that's what the research is telling us at this point in time.
It's so
Now,
helpful to know that, because so many times we are doing so much till if it's not something that's being told to us repeatedly, hey, watch this, we tend to lose sight of it and lose focus on it. And so it's like, well, I didn't know, and so we're hoping that, as we give these video series and as we talk about different subjects, that women will know. And then they have some place that they can go back and check and say, what does she say about that? I can't remember. Let me check and see what she said, right? So now you got some place you can sign on to Medi-Helpz, our Facebook group, and you can go to our website and you can see all the information that you need to see in case you need some additional help. So, Carolyn, before I close out for this evening, or before we close out for this evening, I just want to ask you, is there any one thing that you would like for all women to take from this conversation that we've had in reference to women and strokes? And I do,
just
before I have you go forward, what I do want to ask you is strokes age related? Like, can you get a stroke if you're like 17 or 18 years old? Can you get a
absolutely,
stroke then?
absolutely. I have had a 3-year-old to have a stroke. So no, it's not specific to that. And that is young. I have had some 17-year-olds and some 20-year-olds to have stroke. Absolutely. Um,
But what could cause
now,
strokes in children?
oh yeah, yeah. That's what I said. He was 3 years old. And nobody wanted to believe it. And when I looked at him, I said, he looked like he's had a stroke. But why wouldn't he have one? He has arteries. He has all the structures and body parts that everyone else has. You just don't think that a child would have a stroke. He had hypertension that was undiagnosed. I have had some 5 and 7 year olds with high blood pressure, and they don't know until something happens. They come in the hospital and you take their blood pressure, and it's consistently high. Like I said last week, if you have two high readings, you are hypertensive. Whether it's the top number that's consistently high, the bottom number that's consistently high, or both numbers that are high, that equals hypertension. That equals high blood pressure. So yes,
So
it is not age related.
So with the children, though, how, I mean, is it their diets that's giving them the possibility of having hypertension at such a young age? Is it they're not getting enough exercise? I mean, what could it be? What are
I
some of
don't
the
know.
reasons why they could have?
At this time, it's been a little bit since I researched that, but there are certain units in these children's hospitals that have children that are hypertensive. I don't know if it's their genetic makeup. I don't know if it's specifically their diet. I mean, at 3 years old, what are you eating? Okay, you're basically eating whatever someone gives you. But yes, and I mean, so they have to be controlled and monitored just like everyone else.
Well,
Okay.
I most certainly thank you for putting that piece in there, because we as women, especially our young women that have babies, are not thinking about, oh, my child can have a stroke. They're not knowing that information that, yeah, your baby could have a stroke and you not know it. So it's important for you to make sure that you're getting them checked regularly and asking questions. So I'm going to go ahead and let you end the evening with your beautiful smile by letting us know what your final takeaway points are for women and strokes.
When it comes to women and stroke, let's just be cognizant of any signs and symptoms that we may have that we would normally blow off. Whether you want to call your physician and ask about it, but the best thing to do is get to the emergency room. That way, prevention is key. And time is of the essence, because the more damage that comes to your tissue, the more damage your body is going to have. So if it can, a lot, like I said, with the TIA, they resolve. With the stroke, the quicker the treatment, the better off things are, especially if it's an ischemic stroke. Now, hemorrhagic stroke, they treat it a little bit differently. You may have to have surgery, but we still need to have that diagnosis as early as possible so that treatment can start as soon as possible. So let's take care of ourselves. And I know people say women have babies every day. Well, they do, but you add hypertension onto that, and then you have a human growing inside of you, that increases your chances of having a stroke. So, and some of the medicines that you were taking before pregnancy, you may not be able to take during pregnancy. So, you definitely need to watch that, because there are a lot of patients I've had in ICU, female patients that have had a stroke. They have recovered, and I'm thankful for it, but don't think it can't happen, because family history is an issue. So you have to do that.
So I thank you so much for coming once again and giving everyone a word, especially women. I want everyone, whether you're watching this live or whether you're catching a recording of it, please know once again that this information is available. It will be available within the next 3 days on our website, and it's available and today is Wednesday, March 1st. So it will be available on our Patient's Voice, Charms by Patient's Voice Facebook group within the hour. Thank you so much and have the rest of a great day wherever you are and whenever you are viewing this. Thanks, Carolyn.
Thank you, Sandra. I appreciate it. We'll talk soon.